Aham. How are you, my friend? This is Samuel Sane from Kenya. I'm here at KIMS Hyderabad, and I have a good doctor, and I would like him to introduce himself. He is Dr. Jagadeesh Kumar. Doctor,
Hi.
say hi to your people.
Hi. So I am Dr. Jagadeesh, senior consultant physician, specialist in internal medicine, diabetes and lifestyle disorders. So my friend here came to discuss about few common doubts about diabetes and also other commonest healthcare problems. I'll go ahead.
Good. Thank you, doctor. I have a question.
Yeah.
What is your specialty?
So yeah, that's a right question. In simpler terms, I'm a physician, and you ask my specialization. I am specialized in internal medicine. So after our graduation MBBS, we do a specialty called internal medicine, that we have a holistic approach of entire whole body. So we see the basic complaints and we analyze and we diagnose the problem, and based on that most of the healthcare problems will be dealt by a physician. In case if we fail, and if in case we need the further level of management in terms of a procedure or a surgery, we recommend to go the patient to the respective department. Otherwise most of the health problems will be dealt by a internal medicine specialist.
Internal medical specialist. Okay, we make a mistake. Maybe I'm sick, I feel I have headache, I have go straight to a doctor who deals with a neurosurgeon. Is it right?
True. See, that's a problem. When I say, simply speaking, most of the symptoms, as Sam was telling, headache. So the moment it's headache, people go for a neurologist or a neurosurgeon. So please understand, more than 70% of your headaches doesn't require a neurologist or a neurosurgeon. Many of the times it could be stress headache. Many of the times it could be migraine. Many of the times it can be hypoglycemic headache. It could be because of simple dehydration. So the whole point is, I'm not trying to tell that you shouldn't go there, you shouldn't go here, but an internal medicine specialist is your first contact doctor.
Internal medical specialist, your first contact. Get noted that. For example, doctor, I'm sick, I feel I'm unwell. What are the steps, maybe when I visit your office or your clinic and I want you to treat me, what will you recommend me to do? What test will you recommend me to do first?
Yeah, because see, tests are directly related to your symptoms. So many of the times I may not require a test also. So somehow, because of too much availability of the tests or too much information on internet,
Yes.
people directly jump into tests.
Yes.
So we are clinicians. Clinician in the sense, you talk to the patient, understand their symptoms, analyze the symptoms, and come to a diagnosis.
Yes.
Now, when I'm not sure about diagnosis, I require the help of a test. So at times I don't require any tests. Your symptoms tell me the disease,
Yes.
and I treat it.
Yes.
So it's always based upon the patient's symptoms. We take the next decision, and
Yes.
we take the journey forward.
Good. For how long have you been practicing internal medicine?
I'm a specialist in internal medicine for the past 12 years.
12 good years.
Yeah.
Seeing patients on daily basis.
Of course.
About how many patients have you ever met?
On an average,
approximate.
On an average of 30 patients a day, 30 to 40
in a day.
In a day,
30 to 40 patients in a day.
So
multiply
into
by 365 days.
365. No, of course, you take some 20 holidays.
20 holidays.
So probably it is 340 into 300.
Even let's give it 300. 300 multiplied by 12 years.
300 into 30 is 9,000.
Sorry, we did wrong. Look,
300
Per
into
day,
30,
per day you have
9,000.
30 patients a day.
9,000 into 12, probably a lakh patients and more.
There are so many.
Or probably during COVID times, only for 1.5 years, I have seen 1 lakh patients.
1 lakh
So
patients.
probably my patient base should be around 2,000, no, 2 lakhs. And also I do a lot of videos. I do a lot of articles
Yes.
on newspapers, on daily magazine. I write for Times of India, write for Deccan Chronicle.
Yes.
And I also do a lot of healthcare activities and health awareness programs for a lot of software companies.
Yes.
Yeah, of course, I have a good significant
Wow,
patient base.
that is good. Only here in Hyderabad or whole of India?
My current practice only in Hyderabad, but during COVID, I have treated pan India. I have patients in Bangalore, in Delhi, in Jaipur. I have to treat a lot of people on online, on teleconsultations.
Yes.
Yeah.
Wow, that is good. I have another question, doctor. Do you have any rewards so far?
Rewards.
Rewards, yes.
Of course, I have a very strong patient base. Of course, they a lot of rewards for me.
Yes.
People do get too much of expensive gifts. But you ask me rewards as a doctor, the reward is always immaterialistic.
Wow.
My patient, a sick patient, a young sick patient coming to the hospital,
Yes.
my challenge is, am I bringing them out? And if I'm sending them home, the smile I see is the best reward.
Wow.
The family
I like
comes
that.
back.
I wish you repeat it again.
The family comes back
Yes.
with wife and husband, kids.
Uh-huh.
They have a huge amount of gratitude.
Yes.
The reward is seen in the eyes.
Wow.
So that is the reward any doctor can get.
So even when you are sleeping, when you wake up, you feel good and comfortable because you treated a patient and now you can see the smile.
Yeah, I'm
Wow.
100% confident a doctor enjoys rewards only in the form of smiles and gratitude from the patient.
Yes.
You tell me any materialistic, I think after my 10 years of practice, I'm beyond that.
Wow, I like that, doctor. I have another next question.
Yeah.
How many diseases have you encountered so far?
This is, you are asking an internal medicine doctor because as I told, every disease comes under internal medicine, every disease. Only that once I can't treat, once I don't know,
Yes.
I take the help of my colleagues who are subspecialist into each wing I might.
Yes.
But you ask me, we are the first contact doctors and we decide on how the journey goes forward. So it's nothing like there is no limitation for me.
No limitations, true. I agree with you, doctor. Today I would like us to discuss about this disease known as diabetes. What is diabetes?
What is diabetes is very simpler to put up. But if you ask me, more than 40% of the patient load or the morbidity currently could be because of only diabetes. So simply speaking, diabetes, though the technically and in depth of the knowledge, diabetes damages every part of your body because it damages the blood vessels.
Blood vessels.
Blood vessels. So, but simply speaking, what is diabetes, you ask? It is lack of insulin hormone or lack of functioning of insulin hormone, which increases the blood sugar in the body.
Yes.
So high blood sugar, the reason for high blood sugar is you don't have sufficient amount of insulin or insulin is present but it is not working.
Yes.
So simply speaking, diabetes is about a person having high blood sugar levels due to lack of insulin.
Due to lack of insulin hormone. Okay. What causes diabetes?
Yeah, again, diabetes is a polygenetic disease. So it is multifactorial, not one single factor. The first thing we have to talk about your genes. So it comes from the families.
Family.
So if your parents both are diabetic, mother and father both are diabetic,
Yes.
the children having diabetes, the possibility is around 45 to 50%. Not all, 45 to 50.
Okay.
So half the children can have diabetes if both the parents are diabetic.
Diabetic.
And if one parent is diabetic, the chances for you to develop diabetes is 35 to 37%.
Yes.
So this is about genes. What other factors?
Yes.
Other important what people completely ignore in current world is how much you eat, how much you walk, how much you work and burn calories in a day.
Yes.
And the other important thing a lot of people miss is your sleep and stress.
Your sleep and stress.
So we always talk about, when we talk about diabetes, you don't eat this, you eat this, you eat little, you walk, you exercise.
Yes.
These are the 2-3 common things most of the doctors or the patients are aware of.
Yes.
But I insist something very important is,
Yes.
are you sleeping well? Are you sleeping 8 hours a day? How stressed out are you?
Yes.
If you have bad and poor stress, you are stressed out always.
Yes.
You don't sleep well. This is a significant problem or risk factor
Yes.
for developing diabetes.
Another question, doctor. Are the foods that we eat cause diabetes?
Of course, as I told, genes, food, how much we work, and how much you sleep. All these four are equally important. But when you say food,
Yes.
there are really good food. I mean, say healthy food.
Healthy food.
There are not healthy food.
Yes.
But unfortunately, unhealthy are attractive.
Yes.
Unhealthy are tasty.
Yes.
So evolution of social media, evolution of photographic skills,
Yes.
makes everything attractive.
Wow.
So I divide, as you asked me about food, I divide the food into unprocessed food, processed food, ultra processed food.
Yes.
So this unprocessed food is healthy,
It's healthy.
ultra processed food just avoid. In other words, high glycemic index food, low glycemic index.
Yes.
High glycemic index food is nothing but our bakery, cakes, pastas, fried noodles, all the fried things, all are ultra processed.
Yes.
Unprocessed are fresh from the farm. Pulses, wheat,
Yes.
oats, fresh fruits and vegetables are unprocessed.
Unprocessed.
So if you want to deal with diabetes, the first thing one should talk about is try to eat healthy.
Eat healthy.
Okay.
Good. Which food do you recommend people to eat generally?
Yeah, that's a nice question again. When we talk about food,
Yes.
there is a lot of dilemma among people. In India, southern part of India is rice eaters.
Rice eating.
Northern part of India is more of wheat. They eat chapati, roti.
Roti.
Both are correct. Both are correct in their own way.
Yeah.
But quantity.
Quantity
is important. If you are eating rice, your rice portion have to be little.
Yes.
So because rice has high glycemic index compared to wheat.
Yes.
But also how much you eat, how much are you working? Are you burning your calories?
Yes.
So now in a smart world, people don't realize our phone has become smart. Our system has become smart.
Yes.
Our home has become smart. Did we become smart?
Yes.
So we are eating more than what is required.
Yes.
We are working less than what is required.
True.
So that is the reason for diabetes. It's not just only diabetes, your hypertension, your high cholesterol. So all these lifestyle diseases is only because the poor control over the food and lack of physical activity.
Yes. Wow. That is good. How do someone knows that I'm diabetic now?
Yeah, very right question asked. So diabetes never comes out like a wound. Diabetes never, none of the people know, because for example, when I ask you,
Yes.
heart attack, or everyone knows chest pain, breathing difficulty,
Yes.
all this. But diabetes will not have any symptoms where diabetes people come to the doctor. So diabetes most of the years, until one of your organ damage,
Yes.
until you do a blood test, you will never come to know that you have diabetes.
So it
So
is
it is
important.
painless. It is symptomless initially for quite a long years. So because you don't have symptoms, because you don't have pain, so people usually miss that they have diabetes.
Yes.
Common symptoms what people talk about is lot of thirsty, more drinking water,
Yes.
lot of urination, polyuria, and also weakness.
Weakness.
But these are constitutional symptoms, that these are not specific. Because you are drinking more, because you are going lot of times for urine, because you feel weak.
Yes.
No one suspects, no patient thinks that they have diabetes and get a blood test done.
Yes.
So as a doctor, I always recommend all my patients, once you are 25,
Yes.
always keep checking your diabetes once in a year at least.
Once in a year.
Once in a year, please check fasting blood sugar,
Yes.
and 3 months average called as glycated hemoglobin or HbA1c. Just to do this test once in a year.
Yes.
So just to make sure that we are identifying the diabetes quite early,
Yeah.
before it shows any symptoms.
Good. Doctor, what type of diabetes do you have?
Yeah. So there are many types of diabetes. In fact, when I go into the deep literature of endocrinology, so we have at least 6 types of diabetes.
6 types of diabetes.
But it's too much of confusing for the public. When I'm teaching for my students,
Yes.
I talk about 6 types of diabetes.
6 types.
When I'm teaching for the public, for the society, for the social, I don't confuse them. I say it is simply 2 types.
2 types.
Type 1 and type 2. Type 1 is the body is not producing enough amount of insulin.
Yes.
So lack of insulin is type 1 diabetes.
Lack of insulin.
Insulin is type 1.
Type 1.
Type 2 is insulin is there, but it is not functioning well. So inefficient insulin is type 2. First one is insufficient insulin.
Yes.
Not sufficient. Type 2 is inefficient. Insulin you have, but it is not working properly.
Yes.
So these are 2 types of diabetes.
Lack and
Inefficient and insufficient.
Good.
So insufficient is low insulin. Inefficient is you have insulin, but it is not working properly.
Yes.
So type 1 we see commonly in the younger age group. Yes. Probably 8 years, 10 years, 12 years. It starts from childhood. Yes. Many a times. In the teens. In the childhood.
Yes.
And type 2 diabetes usually starts after 30 years.
30 years.
30 years. So adult, that's why type 1 is called children. Type 2 is adult onset.
Yes. Adult. From 30 years.
And type 1 you can treat only with insulin, because lack of insulin. The problem is no sufficient insulin in the body. So type 1 tablets doesn't work.
Yes.
It is insulin only. Type 2 we give tablets for the insulin whatever is already present.
Yes.
To work better.
To work better.
So that's the major difference between type 1 and type 2.
Okay.
Type 1 is insulin dependent diabetes. Type 2 is non-insulin dependent diabetes.
Yes. Another question. Can you treat diabetes and go away completely?
Yeah. You mean to say, does diabetes have cure?
Cure.
Permanent cure.
Permanent cure.
Fantastic. Well asked. So type 1 diabetes, so far there is no cure. Because type 1 no cure.
No cure.
Because it is insulin dependent.
Yes.
There is no insulin in the body. Body is not producing insulin.
Yes.
We have to depend on taking insulin from outside.
Yes.
That's type 1.
Yes.
Type 2, then I'll say it is a spectrum from 1% to 100%. So someone who has got, for example, because we'll talk about values.
Yes.
More than 126 mg per deciliter,
Yes.
fasting is called as diabetes. Okay.
Yes.
More than 126.
Yes.
So someone who has got 135, I call them diabetes.
Yes.
Someone who has got 235, I call them diabetes.
Yes.
Someone who has got 335, I call them diabetes. So now what I'm trying to tell, someone is in the starting, I can treat him, bring him back. Someone at 230, he needs tablets. Someone who's at 330, along with all lifestyle modifications, along with all tablets, we might need insulin also. So problem is, in the borderline people, we can always bring them back with only lifestyle modifications. So again, what are my lifestyle modifications? Eat less, walk more. So choose your food properly. Small frequent meals. Instead of eating 3 times heavy meal, I say eat 5 times but half the portions. So these are simple tips to bring back people who are borderline or starting diabetes to normal. So if you ask me, is it a permanent cure? I say yes. It might be for 5 years or 10 years or 15 years. We may not require medication provided you maintain a proper lifestyle. So this is the trick.
I have another question. I don't know whether how you take the question. What part of the body that produces this hormone, insulin hormone?
Yeah. So very well asked. Insulin is secreted from an organ called pancreas. So pancreas produces the hormones like insulin, glucagon. So if pancreas is damaged or disturbed, your insulin production decreases and that causes one more diabetes. So this is something we call it as type 2C diabetes. Type 2C diabetes is diabetes which is caused by an infection related damage to the pancreas.
Can you do what you call pancreas transplant to cure that?
Yeah, this is under still research level, but a diabetes which is caused by damage of pancreas, yes, pancreas transplant is the treatment.
Yes.
But not for this type 1 or type 2. So
Okay.
as I told, there are a lot of diabetes. A diabetes which caused exclusively because of that can be cured because of islet transplantation. We call it as islet. Pancreas cells internally are called islets, cells of islets. This islet cell transplantation they do to treat diabetes.
Okay.
Not all the diabetes.
Not all the diabetes. Please, my people understand what diabetes and maybe what test do you do to determine the type of diabetes?
So yeah, we do fasting insulin, we do C-peptide, and we do GAD antibodies, glutamic acid antibodies test. So based on this test, I decide is it type 1 or type 2.
Yes.
Then because that will give us information about how much insulin reserves does the body have. If the patient has got insulin reserve, it means that it is type 2. If he doesn't have insulin reserves, it means it is type 1.
Type 1. Okay. Now, another great question. What kind of testing equipment do you use to determine this disease?
So testing equipments, as I told, we send all the tests to the lab. So we check, as I told, fasting blood sugar or HbA1c or antibody tests at home level or at clinic level. The simple thing is a glucometer.
The simple glucometer.
Glucometer.
Only that.
A glucometer tells me if your random blood sugar is more than 200, yes, you're diabetic. If your fasting is more than 125, you're diabetic.
Yes.
Or urine dipstick. So urine sample we check, and if there is high glucose levels in the urine, it is understood that you're diabetic.
As simple as that.
Simple. See, these are, see, when you talk about tests,
Yes.
are we doing it, are we identifying at a clinic level or a hospital level? Hospital level, the tests, I have various tests.
Yes.
I, first of all, to identify whether you have diabetes or not. After identifying diabetes, I have to check what is the level of diabetes and how much damage it has caused.
Yes.
So then we start checking your heart, ECG, 2D echo, because as I told beginning, diabetes is about damaging vessels, blood vessels. So where are blood vessels? All over the body.
Yeah.
So where is the damage? All over the body.
Yes.
So first to affect is eye, heart, brain, kidney, and your vessels in the legs.
True.
So we check all these organs to see what is the level and intensity of the diabetes.
That is great and encouraging. Now, how do you recommend someone who is at home, who is far away from the clinic and or actually to be healthy? What kind of instrument or test equipment?
So again, the simple is being a senior doctor treating diabetes, thousands of patients for the last 12 years. Now that I know the disease, see, if I don't know the disease, I need my patient next to me to examine.
Yes.
If I know the disease, all I need is the values.
Only the values.
Values. I can assess you and I can control the diabetes even on a phone. So that's what we do, a lot of teleconsultations all over the world. In fact, when you're talking about, do you have patients out of Hyderabad? Yes, I do have patients in Dubai. I have patients in Singapore, and I have an experience of treating gestational diabetes. In the sense, gestational diabetes. This is diabetes in pregnancy. So this is tough and challenging. Pregnant women becoming diabetes, so they should eat well, but they shouldn't go their sugars out of control. So we have to have a very slight and strict margin. So I have, because I worked very closely with a tertiary obstetric center. So I have more than 3-4 thousands of um, gestational diabetes patients. So I'm an expert in that. So I used to treat patients who are pregnant with diabetes in Dubai. I used to treat patients with, gestational diabetes patients in Singapore. So we treat. It's easy. I need to know the values. If the values are very high, I ask them to do blood tests for 7 times in a day. Prick. Before eating, 2 hours after eating. Before lunch, 2 hours after lunch. Before dinner, 2 hours after dinner. And in the midnight at 1 o'clock. So the 7 values give me a lot of information how your sugars are going. So we treat on phone. We do teleconsultations.
Wow. I have another disturbing question. What do I need to avoid when I'm dead?
As I told, high glycemic index food is you have to avoid, and make sure you're walking for 30 to 45 minutes. Make sure you're drinking enough amount of water, at least 2 to 2.5 liter a day, and make sure you are less stressed out and sleeping well. Simple tips.
Doctor, there are people who are addicted to alcohol. And they are dead. How do you advise?
See, any amount of alcohol is not good for body. Any amount of alcohol is not good for body.
Why do you say this? Yeah, because there are people who love this.
Oh, see, just because they're loving, I can't say what is not scientific. Alcohol is not good for health. Simple.
Yes.
So there are considerations that few people tell 1 peg is good, 2 pegs are good, but the lot of studies said and research has done, not even 5 ml of alcohol is good for health. Now you have a risk factor diabetes, you have alcohol, both together you have more complications. So there's nothing like you should take, you shouldn't take. No means no.
Doctor, you're becoming an enemy to your company.
I don't mind. I am a doctor. I only talk what research says.
Wow, that's good. Your advice. You see, we do things that we don't know. They are actually negative to our lives. And like my desire to see my people all over the world, in my country, Kenya, really help. That's why I came all this far to meet you and other doctors so that you can advise my people on what to do and how to live.
Yeah, well, very important. Very important. Future is all about our longevity has increased.
Yes.
Now that you have to decide, do you want to live healthy? Do you want to live sick? Living is there. You are going to see in India the lifespan during independence is 37 is the average. 37 years. I'm talking about 70 years back. Indian lifespan average was 37 years. Today average Indian lifespan is 70. 70. So science is improving, healthcare is improving, research is improving.
Yes.
So we are bound, if everything goes well, all of us are going to live 75 to 80 years.
Yes.
But what is your quality depends upon how you live, how you take care of your body from 35 to 55.
Yes.
That depends your life later on from 55 to 75.
Yes. Wow, that's great. Are there diseases that are related or can cause diabetes? Like maybe I've heard of hypertension.
All. I put all the lifestyle disorders in the same basket. Diabetes is one, hypertension is high blood pressure, dyslipidemia is high cholesterol, hypothyroidism related to thyroid, and obesity, the master of all this. Once you put on weight,
Yes.
it brings all this package. You increase weight, it causes diabetes. You increase weight, it causes hypertension. You increase weight, it causes dyslipidemia. All this put together increases your stress. Your stress again increases all this.
Yes.
So everything is a vicious cycle. So we need to break the loop. You are healthy in two things, you automatically become healthy in all rest five things. You are not healthy in two things, all the five things are following.
Yes. Now I have a funny question here. Since when I started coming to India, whenever I go to any hotel, I'll find or restaurant, I'll find food is full of
Pepper.
Does it affect diabetes patients?
Pepper directly doesn't affect diabetes patients. But if you look at, again, food is directly related to your demography and your culture of living and working.
Yes.
So people who are in Italy, people who are in Germany, people who are in Spain, they have a different culture. Their culture is different, their lifestyle is different, and that food matches that. If you ask Indians, the lifestyle is different. If you go back 50 years back or 70 years back, Indians are more into farming. They get up at 5:30. They have to do a lot of work in the farm and fields. They come back home at 4 o'clock, 5 o'clock. They finish their dinner before 7. 7 o'clock, everyone sleeps. Now that we are continuing the same rich food with not that lifestyle. So that's what I was telling. So your food is always based upon your culture, the way you are brought up, the way you live in your surroundings. After the globalization, everyone's lifestyle have changed, but the food didn't change. So we are in excess of food with lack of physical activity.
Wow, that is good. I would wish you to come to Kenya and conduct a medical camp and help my people.
Love to.
I know they'll enjoy and they'll be happy and live healthy.
Because I, being a physician, internal medicine specialist, most of my treatment happens without doing any procedure or surgery.
Yes.
So my investment is my knowledge.
Your knowledge.
And I can speak, I can treat. So yes, of course, if my presence is required, I'm always there.
Yes.
Otherwise, my videos help. Yeah, I keep. I do have an Instagram handle.
Wow.
You can always just club up.
You can tell them your
Yeah.
Instagram handle.
Yeah.
You have YouTube.
Yeah, yeah. So I'm Dr. Jagadeesh Kumar. I'll be in touch with Sam, and I keep on. See, medical information and health education is something I'm used to.
Yes.
As I told, I have more than 150, 200 videos. Of course, not my channel. It's into multiple channels. And I do write a lot of articles on the news channels. And I have a lot of TV interviews and news channel interviews. So educating is more important because treating 30 patients, doing one video can reach out to 3,000 or 30,000 people.
Sure.
And a knowledgeable person have to transfer the information into the public rather than a lot of non-medical people doing.
Yes.
So thank you.
I'm so happy, and I believe we shall continue to work together.
Definitely.
But before we wind up,
Yes.
you have been working for King's Hospital.
Yeah.
Why do you like working?
Oh, very, very rightly asked question. KIMS is one of the largest conglomerate of hospitals working in all specialities.
All special.
As I told you before, I'm an internal medicine
Yes.
specialist where we see everything.
Yes.
So most important is a multi-speciality hospital which caters from birth to death. So every speciality, KIMS is one of the pioneer.
Yes.
You name transplantation, you name pediatrics, you name genetics, you name oncology.
Yes.
This is, and it caters to all levels of the people.
Yes.
Very poor background to the very elite. So that's one strong reason I chosen KIMS.
Wow, I feel good and comfortable when telling me this. I feel encouraged because you see, mostly people in Kenya, they okay, most of them travel to India for treatment. You hear people talking about high amount of money
Oh.
for treatment.
So again, this because you spoke about money. As a doctor, I keep telling you, even recently my article is there in Times of India. You trust your doctor, everything will fall into the place.
Yes.
So identify who's your doctor because doctors are trained to treat patients not just with knowledge, with empathy and passion. So this includes best treatment in the sense the best possible treatment with the least cost.
Yes.
So that is where my expertise, my knowledge comes into the picture. If your doctor is not skillful, your investigations go high. If your doctor is confident, accurate, I don't require 100 investigations. I pinpoint.
Straight away.
Simple. That's what I told. Physicians, we are trained to identify the diagnosis with no tests. So you ask me, I can treat most of the diseases with the least number of tests.
Yes.
So choose your doctor, the right person.
Yes.
And KIMS, when you ask me about KIMS, KIMS is founded and the chairman is Bhaskar Rao Garu,
Yes.
who's a doctor by himself.
Yeah,
He's a cardiothoracic surgeon. So the passion what he carried for 40 years.
Yes.
So he's a fantastic clinician. So that only a doctor can have to do good for the society, for the patient in the best possible way. So that's something important about KIMS.
Wow. So in short, you can say it is affordable.
Affordable,
accessible.
Accessible, affordable from point, I mean, everything from neonatal, right from birth to the last. Nothing, everything is under the roof of KIMS.
Wow. So, in short, you can tell Africans, Kenyans, and everybody in the world that KIMS have got all the specialties
They need not
under
search.
one roof.
Yeah, I think I have seen a lot of people from international patients who come to India, even from other states. They have a different concept. Uh, for neuro, we'll go to that hospital.
Yes.
For gastro, we'll go to that hospital. For onco, we go to that hospital. So nothing. So this is a hospital which caters everything, not just catering everything, but it is always under the supervision of a doctor who's the chairman.
Yes.
Is always for the patients,
Yes.
to the patients, what best we can do.
You know, Doctor, I'm a beneficiary of King's Hospital.
Yeah.
He's,
Is
and now I'm healthy, and that's why I decided to help other people.
That's true. So lack of information is the biggest disease, and I'm very thankful for you.
Thank you.
Because I keep doing a lot of things to educate people,
Yes.
and I'm very happy to share with you.
Thank you.
So because promoting health always comes with health education first.
Sure. I appreciate, and I would like you to remind my fellow Kenyans and Africans, the whole world, your name and where they are.
Yeah, I'm Dr. Jagdeesh. So you can see me on my Insta handle Jagdeesh underscore Vadaparthi. I'll be tagged with Sam so that you can find me easily.
Yes.
And thanks and best of the care.
Thank you so much for watching this interview, and I know it will be beneficial to you and your family, and may God bless you. Have a good time.
Thank you.